Hi, welcome back to our nursing procedure tutorials or demonstrations. This time, I'm going to show you and to demonstrate to you how to prepare injectable medications and how to give it to the patients intramuscularly using the deltoid muscles and the gluteal muscles. Like any other procedures, we have to follow the protocols. First, we have to identify the patients correctly and then explain the procedure to your patient that you are going to give injection and tell her how she can cooperate, and then wash your hands thoroughly and gather your equipments. And then you can go to your patient's room, provide privacy, and start with your procedure. I'm going to prepare injectable medications to be given intramuscularly. So, always remember the 6 rights in giving medication. First is a right medication to be given to the right patient through a right route or right side, and to be given with the right dose, right at the right time, and the right approach to your patient. Okay, so now we are going to prepare medications from vial and from ampule. Okay, so of course, we have to do thorough hand washing before preparing your equipments. Okay, which I have done already. So the equipments that we're going to use are syringes with needles attached, and extra needles for injection. Also, we need alcohol swabs for disinfectants, Band-Aid to be given or to be applied to your patient's site of injection after the injection, kidney dish, a clean kidney dish as a container of your medications before or while going to the patient's room. Of course, injectable medication should be prepared in the medication room, not at the patient's bedside. Okay, so first is we have to open the vial. Before that, you have to read the label or the medication, whether it is the correct doctor's order, and then check for the expiration date and the cloudiness of this medication. Okay, so let's remove the cover of the vial, get alcohol swab, and clean the top of the vial. Okay, and then get the syringe secure the needle attached to it. Okay, loosen the plunger. Okay, remove the cover and have the correct amount of air in the syringe. That is how much you will get from the vial. That's the amount of air you will inject to the vial. Let's say we need 2 ml of this medication upon your calculation. So put 2 ml of air in your needle, in your syringe, and then inject it into the vial in a vertical direction, and then invert the vial and get the 2 ml of this medication. Make sure that the calibration of the syringe is facing onto you so that you can easily read the medication if it is already 2 ml. Okay, so we have 2 ml of medication. It should be at your eye level. Okay. This cover, you should do it or recap the needle in a scoop method. Never hold the cover of the needle. So this is the scoop method. Okay, remove or change the aspirating needle with a new needle. Okay, secure it. with the syringe. Tap the syringe and remove some bubbles or air. Allow 1 drop of medication from the tip of the needle. Now, this 2 ml medication is ready for intramuscular injection. Of course, we need to prepare alcohol wipes to clean the patient's injection site and band-aid to be applied on the patient's injection site after. Now, I'm going to prepare medication from the ampule. Okay, you have seen this red dot on the ampule. It indicates that on this part you are going to break the head of the ampule. Use a clean gauze to protect your finger from breaking the ampule. Okay. So now it's open, and discard the other half of the ampule or the head part of the ampule. Then get your syringe with a needle. Secure the needle. Loosen the plunger, because usually a new needle or a new syringe is having a tight plunger, so you have to loosen it, and then remove the cover. Okay, hold the ampule at your eye level and insert the needle inside the ampule without touching any side of it, and get the desired amount of medication. If you need 1 ml, then get the 1 ml of medication from the ampule. Okay. Now, since we took the medication from the ampule, it is not necessarily, again, we have to do it in a scoop method. It is not necessarily to change the aspirating needle because it is ampule and we did not touch any side of this ampule, so we don't need to change the needle. We can use this one for injection. Okay, so again, tap the syringe and remove some air or bubbles, and make sure that you will have only the correct amount of medication, which is 1 ml. Okay, so our second medication is ready. Again, place another alcohol wipes and another band-aid to be placed to your patient's injection site after giving the injection. So, our medication now is ready, and we can go now to the patient's room. We can wear unsterile gloves as optional, but better we wear it for our own protection. Okay, of course, we have to identify our patients correctly and explain the procedure, provide privacy to our patient. Okay, good morning, sister. What is your name? She said, I'm Aisha. Okay, Aisha, can I check your identity band? Okay, this is Aisha Ali Al-Shamari. Aisha, I'm going to give you injection here on your arm. And then she said, okay. So, to have a better instruction and a better look on how I'm going to do the injection and the correct technique of it, I'm going to do it to our simulator arm. Okay, now I'm going to give intramuscular injection to the deltoid muscle. Okay, how to locate the deltoid muscle? Just place your 3 fingers below the acromion process, and here, this is the site of injection. This is the deltoid muscle, and this is the site of injection. With your prepared medication, okay, with your 1 ml medication, remember, giving medication to deltoid muscle should be 2 ml and below. But if it is 2 ml and above, or more than 2 ml, you have to give it to the gluteal muscle. Okay. First, we have to clean the injection site in a rotating motion from inside to outside, about 2 inches diameter. Okay, make sure that you have your ready band-aid after the injection. And another alcohol wipes. Okay, as the correct medication, remove the cover, make sure that there is no air. Pinch the muscle of the patient and inject in a dart motion, 90 degrees angle, quick and dart motion. Okay, and then hold it and aspirate the plunger. Check if there is blood from the medication or that is coming from the patient's muscle. If there is no blood, meaning to say you did not hit any vein, and it is safe to inject the medication. So, push the plunger slowly and give the medication to your patient. Remove it quickly and massage the injection site. This sharp thing should be directly placed into the sharp box if it is near you. But if it is not with you, you can place it to your kidney dish, and then once you finish, place it to the sharp box. And then get your prepared band-aid to be placed on the patient's injection site. Okay, that's it. Then place it to the sharp box. Here I'm going to show you how to inject it to the gluteal muscle. If the medication is more than 2 ml, we have to inject it to the gluteal muscle because this muscle is quite bigger than the deltoid muscle. Okay, as you can see in a transparent buttocks, the red muscles that you can see is the site of injection. We have to avoid that yellow nerve, which is the sciatic nerve, because pricking this nerve can cause paralysis to our patient. So only in these red muscles, these are the safe area for injection. Okay, so I'm going to show you the other side of the buttocks. We have here the indicator, the green and the red light. If the red light signals, that means we are at the wrong site of injection, but it is the green light signals, that means we are at the correct site of injection. So again, we have to clean the area using alcohol wipes in a circular motion from inside to outside, about 1 to 2 inches in diameter. Okay, then get your medication, open another alcohol wipes and keep it ready with you. In a dart, quick manner, you have to inject this medication. Okay, how to locate the site of injection? Place your hand on the patient's hip and this thumb at the side of the patient's hip, and the others forearms should be locating like this. That triangle area is the site of injection. I will show you. This triangle area is the site of injection. Okay, so in a dart quick manner, I will inject the medication to our patient's gluteal muscle. Pinch the muscle of the patient. Inject the medication in a quick and dart manner. Okay, hold it. I want to show you it clearly. And then aspirate. If there is any blood, then withdraw the medication or withdraw the needle and change the medication. But if there is no blood, meaning to say you did not hit any vein, then you can slowly push medication or inject the medication to your patient. Then quickly remove and massage gently the gluteal muscles of your patient for better absorption of the medication, and then place the band-aid that you prepared to the injection site. Okay, so this is how to inject intramuscularly to the gluteal muscle of the patient.